This video is going to be over the heart sounds. So we'll talk about S1, S2, and probably S3 and S4. So S1 and S2 should obviously always be there. S1's due to the atrioventricular valves closing, so tricuspid on the right, mitral on the left, and that creates a turbulence of flow that sounds like a lub under the stethoscope. Now, S2, this is due to the semi-lunar valves closing, so pulmonic valve on the right, aortic valve on the left side of the heart, and that creates a turbulence of blood, and that creates we hear the dub sound with the stethoscope. And we can see here between S1 and S2 is systole. So this represents systole. Okay, so because S1 marks the end of diastole, S2 marks the end of systole, so we can say that red line represents systole. So the blue line, the time between S2 and S1, because S2 marks the end of systole, right? And S1 marks the end of diastole. Well, it's going to be your diastole. And the heart generally at normal resting rates, it's going to spend more time in diastole than systole, right? And we've talked about that when we talked about like mean arterial pressure and how to calculate that. You know, obviously there's more time in diastole roughly, so the pressure won't be exactly between systole and diastole. A basic calculation of mean arterial pressure. Okay, so lub dub, lub dub, lub dub, lub dub. All right. Now that's pretty simple. Now what about S3 and S4? So they're not always there. If you hear an S3, it's going to happen after S2, which makes sense. 1, 2, 3. Okay. But when I draw S3, I always draw it a little bit smaller. So, and why do I draw it smaller? Because S3 is usually a little quieter, right? And that's how you differentiate between a split S2, where you'd have, we call it an A1 and A2 and a P2 for aortic 2 and pulmonic 2. That'd be about the same loudness. Same loudness? They're about just as loud as each other. The S3 is going to be a little fainter. It's not going to be quite as loud. So that's why I draw it smaller. So instead of lub dub, it'll be lub dub dub. Lub dub dub. But the second dub will be quieter. And the best way I can explain this is how I learned it is knowing different states. So we say the state Kentucky. So Ken, do a little pause, then tuck, E. So Kentucky, Kentucky, Kentucky. So Tucky is 2, 3. So 1, 2, 3, 1, 2, 3, 1, 2, 3. Okay, and S3's presence could be normal or it could be pathologic. Now S4, so where's S4 going to happen? Well, S4 is going to happen before S1. Well, wouldn't S4 happen after S3? Well, yeah, but that's if there was an S3 present. So S4 happens before S1, okay? And the state we use to kind of explain this is 10SC. So 10SC, 10SC. So again, S4 is quieter than S1, but if you had a split S1, how would you tell the difference? Well, the split S1, so your T1 and your M1, tricuspid 1 and mitral 1, would be the same, be just as loud as each other, but the S4 is going to be a little quieter. It's harder to hear, so that's why we draw it a little smaller, but they're right together. So 10SC, 10SC. So S4 happens before S1. S3 happens right after S2. So let's explain this in a little more detail. So S3 is going to happen early in diastole. So you have to ask yourself, what's happening early in diastole? Well, we just talked about the cardiac cycle. So early in diastole, the atrioventricular valves just opened. The ventricles have low pressure and blood just flushes back in and blood's hitting the ventricular walls. So what would create the sound is a very compliant or elastic ventricular wall that balloons out and stretches, very elastic, and that will create enough turbulence of blood to create a sound. So this is caused by a very compliant or elastic ventricle. Okay, so blood's flushing right back in early diastole. So what's happening in late diastole? So if S4 happens in late diastole because it's right before S1, well, what happens here? Well, this is during atrial contraction. So that atrial kick. If the atria are contracting, trying to push the blood into the ventricles, this occurs if the ventricle's stiff and it's trying to shove the blood in, and that can create a turbulence of blood. So this is due to a non-compliant ventricle or a stiff ventricle. It'd be the same thing. So this I kind of say is very elastic very stretchy. And then this is due to non-compliant ventricle, means the ventricle is stiff. And S4 is pretty much always pathologic, but we won't go over all the causes. So that's how you tell an S3 and an S4. So Kentucky, so S1, S2, S3. So Kentucky, Kentucky. So lub dub dub, lub dub dub. Now if it's an S4, it would be Tennessee, Tennessee. So lub lub dub, lub lub dub. And S1, or split S1 and a split S2 would sound the same, but the difference is it's a lot harder to hear the S3 and S4 because they're not as loud. They're quieter.